Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about work experience. What does this mean and how do you get it as a brand new medical coder in medical coding? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. When you are looking for your first job in medical coding, a lot of the job listings, and I mean 100% of them, will often say candidate must have 1 year of work experience. Candidate must have 3 to 5 years work experience. Work experience for medical coders is actually applying codes, actually going through records and actually applying codes, having a production standard, having an accuracy standard. These are the things that work experience means when you are trying to get into the field. And when employers are talking about this, how much work experience do you have? And as a new person, you're going to say, I don't have any. And so you're going to run into a lot of, well, we want experience in this and that. What I always tell brand new people is to go ahead and apply anyway for places that are asking for experience. If an employer is going to have their choice between somebody who has work experience and somebody who doesn't, obviously they are going to go for the candidate that does have work experience, because this means less training. Somebody who's had work experience is going to know that there's going to be production standards, there will be accuracy standards, and they will know how to get through the record. If it's somebody that's brand new and very green, just finished school, just got their certification, they know they're going to have to work with them a little bit. But the thing is, with coders who have experience, they're going to be employed unless they want to go someplace new. So a lot of times these employers are just going to have to take the candidates that they get. If you're brand new and you have been studying and you have really been applying yourself and not just expecting, they're going to give me a chance. No, this is a very competitive field to get into to begin with, but you have to stick with it. And when it comes to finding your first job, I always tell people that the best way is to apply everywhere, regardless of whether they're asking for experience or not, or to apply with a temporary agency. There are many temporary agencies out there that specialize in medical professions. Now, before you foo-foo my suggestion for the temp agency, think about this. Every assignment that you go on with a temp service is going to be filler for your resume. This is going to say, okay, I do have work experience. I have had to code records, or I've had to audit, like basically the codes are already selected for you and you're just going through to make sure everything is correct and then sending it on through. So you've already had that experience. Even if you just have one position, or even if you have 2 positions, these are things that are going to add up on your resume. This is going to get you those connections in the industry. Oh, well, we know so-and-so is a medical coder. Oh yeah, they work with a temp agency. Oh, well, how did they work out? Oh, they were great, That's the kind of exposure that you need. That is the best way to be able to get in if you have been applying for not just coding positions, but risk adjustment or medical records tech. Sometimes they're listed under different names. But basically, you want to get in somewhere, somehow, some way, something related to coding, so that way you can start to get that experience and build from there. There are many other positions that will allow you to have some exposure to codes, maybe not coding really, but it is going to get you around the codes and get you around the diagnosis codes and the procedure codes. Medical billing being one of those positions that you can also apply for. It's not just about applying for medical coding positions, because yes, while you want to apply for medical coding positions as a certified medical coder, sometimes you have to get in another way, either through medical billing, medical records, or something like that along those lines. So that way you can have some relatable experience to getting in. Now, there is something out there with AAPC. It's an educational product called Practicode. I want to talk about this today. Now, here's the thing. Practicode is an educational product. This is not considered work experience. With the American Academy of Professional Coders, they do have, when you get their CPC certification, right? which is a popular certification that they have, the Certified Professional Coder. They do have a designation on the end of it. It's -A for apprentice. And this has a 2-year time commitment on it. This basically says you are brand new, that you are within your 2-year time. And sometimes it just depends. If you're working right away, then all of that time that you're working as a medical coder can count towards that 2 years that you have to have that apprentice status on before you can ask for it to be removed. Some people will do what is called practicode, like I said. And sometimes people have mistakenly thought that this is considered 1 year of work experience in the real world. It is not. Again, in order for work experience to be considered work experience, you have to be on production standards and accuracy standards. Practicode is an educational product meant to help the coder to learn more with redacted medical records, right? So all the personal identifiable information is all redacted, and you're basically going through, and it's meant to make you more confident and give you more practice. There are other more economical ways of practicing, but for some people, they say, well, I want to hurry up and get rid of this apprentice status because it's stopping me from getting a job. This is simply not true. People get jobs all the time with CPCAs. A lot of my audience, the majority of my audience is American Academy of Professional Coders. And so I hear from them all the time. I hear from them when they pass their certification. I hear from them when they get their first job. And they do have the apprentice status still on their name. So just because this option is out there, you don't necessarily have to do it. Now, as far as whether it's worth it or not, should you do it, should you not do it, it's entirely up to you. But I am letting you know, because I want to make this clear, that Practicode is not considered work experience. Employers know what Practicode is. They know that it is an educational product. For some people, they have said that, oh, it has helped them, which is great. If it's helping you and you're learning something from it, all the more better, right? I'm not saying anything bad about Practicode. What I am saying, though, it is not considered work experience. Now, the other way, like I said, is going to that temp agency. Now, I hope that you all at least register with the temp agency. There is nothing wrong with at least registering with them and seeing if they have something available. Sometimes these temp agencies have contracts. They get contracts to code for projects and things like that. So if you can get yourself on that project, and whether it is for 3 months or what happened with me, I was on a project that was lasting for 3 months, and they said, okay, well, we're gonna send you on this assignment, and it is for 3 months, and I got my first assignment at a cancer therapy research center. So you wanna talk about getting thrown into the deep end of the pool. I was learning oncology coding, I was doing E&M leveling, and I was doing procedure coding. So there was a lot of things that I was doing. I was under production standards. I was under accuracy standards, because if I wasn't coding appropriately, they were going to get rid of me. And it was me and 2 other ladies. So they were going to pick who they wanted to keep at the end of this assignment. But this assignment led me to my next assignment with this temp agency that lasted for another 8 months until I applied for a hospital that I wanted to work at. And so having the experience that I had with the temp agency, because they were willing to hire me, I had gone to them, I had applied with them, I gave them my application, I gave them my resume, my cover letter. They gave me a skills test to see if I was good at coding, diagnosis coding and procedure coding and E&M coding. And I was just fresh out of school, so I was really proficient with the book and everything. So they took a chance on me. And that is a thing when you're applying with these temp agencies is, the employer doesn't care who is sent to them. They just need a coder. And so they are relying on the temp agency to supply that said coder. And they're expecting that temp agency to go through all the background, make sure everything's okay with this candidate. Can they code? Can they do this? And regardless of whether you have experience or no experience, right? they're going to support you and say, this is a good candidate. This candidate has and meets all the things that you need. This candidate knows how to diagnosis code, procedure code, and E&M code. And so you get in there, you do your assignment, and whether it is for a week, whether it is for 9 months, because sometimes there are some women who go on maternity leave. So when they go on maternity leave, they need somebody to fill in. So they'll sometimes call a temp agency and say, well, we just need somebody temporarily to fill in. Well, now guess what? We have a candidate who just applied with us that is a certified medical coder. Let's go ahead and send them and see how they work out. But you're never going to get that opportunity if you don't apply at the temp agencies. So there's a lot of people that have told me, I will not apply with a temp agency because I want a real job. I was the same way. Trust me. I was like, when I first heard that, I was like, I don't want a temp job. I want a permanent job. But you have to crawl before you walk. And so that was how I did it. And I was able to get in going through a temp agency. And a lot of the people who have watched my channel have said, hey, I went through a temp agency too. And it gave me a lot of experience with a lot of different places, a lot of different specialties. I met a lot of people. It's about that networking as well. So they were able to do those things, meet people, pick up their skills, because not only were they bringing their diagnosis coding skills or procedure coding skills, E&M coding skills, but when they left that place, they also got new electronic health record skills, right? Some were working with just different ones way back in the day. But different electronic health records. They work with encoders. So that's more skills to add to their resume. So as time went on, it got easier and easier. So that's the thing. When they're looking for work experience, they are looking for production standards. What was your accuracy standards? How many can you code? That's what they want to know. So there's a lot of things out there. There's a lot of self-serving information. The information that I share with you guys here is information that I wish somebody would have told me. This was the stuff that I figured out along the way. So I'm sharing this with you all so that you don't have to go through the same hardships that I did when I was out there not knowing anything and applying for these places. And they would ask me, well, how many records can you code in an hour? I'm like, I have no idea what is considered good, what is considered bad, right? Because I was brand new. I was just doing anything and everything to just try to get in. So the temp agency for me was the key. For other people, they start their journey in medical billing, and that's how they end up going into medical coding. Because with medical billing, you're still touching codes, right? Diagnosis codes, procedure codes, E&M codes, modifiers. So you're going through all of those things as you're submitting that information to the insurance company, and then they're either kicking it back to you and you give it over to the coder themselves, or you're the one who is stuck fixing it. Well, now if you are the one who is fixing it and you're the medical biller, you've already been trained in medical coding. There is nothing better than that. Because with billing, you don't have to be certified to be a medical biller. Yes, there are medical billing credentials out there, but you do not need them. Because oftentimes when you're looking at these job listings, and if you don't believe me, check the job listings, okay? The job listings for medical billers will say candidate must either have experience or must have gone through a medical coding program. I have seen that lately. Or they say all you need is a high school diploma or a GED, and training will be provided. I have seen that quite a few times. So there's a lot of things, there's a lot of opportunity out there when it comes to getting into medical coding through billing, because once you've had that time and you understand how the process works and you've been hands-on with those codes, that's going to be able to transfer over into getting you into a medical coding position. Because when you are getting into these medical coding positions, oh yes, I've had experience working in medical billing. Great. Now we've had somebody who's been on the billing side who can work with us and is a medical coder at the same time. What is better than that, right? So don't give up, and really, I hope you guys heed my advice, because this is going to be my battle cry for this month, for the month of October. I'm going to keep harping on get registered with a temp agency. You can Google temp agencies for medical personnel in your area. And you will be able to see all of these places pop up that specialize in medical professions. And they're going to say, we need medical coders, we need medical billers and coders, or you need medical coders. And so that's when applying with them, letting them know you're a certified medical coder and that you're looking for your first job, they will understand, because that is their job, is to get you a job. And if you say, well, Blue, I'm already working, but that's why I'm applying it as a medical coder so that I can get out there. Well, I mean, there's times when you're not at work, right? So think about these things. If they have availability for just like a day, there's nothing wrong with that, with going in and checking it out and seeing what's up, you know, seeing who you can connect with. So that way you can make those connections so that you can get in. But I'm telling you guys to register with a temp agency, register with more than one, because again, these temp agencies sometimes get contracts and they're competing, right? So I mean, you never know, you could get lucky and they say, well, we have a project and they need coders. So would you like to go ahead and work with this project? Absolutely. And that's going to start getting you that where you're looking at the codes, directly applying codes, directly applying E&Ms, directly applying procedure codes. That is going to get you those opportunities. But the thing about it is, you have to still apply, even though they're asking for experience, because you're never going to find those entry-level positions. The way that this industry is, and this is a thing that I wish would change in this culture of medical coding and health information, is nobody wants to train because nobody taught them, so they don't want to teach you. To me, I don't think that that's right, but this is why I always tell my people who are in these degree programs, when you graduate and when you get into those positions of leadership, then it is your responsibility to make sure that you are in the driver's seat when it comes to doing the hiring. If that is your responsibility, then give new people a chance and don't have that stubborn mindset of, oh no, we only want candidates who have experience. Because sometimes candidates who have experience are not always the most qualified. And as far as like what I mean by qualified is, if you have somebody who has experience and they've only ever done one type of coding, say for instance, they've only done physical therapy coding, they've never done anything else. This person is very limited at the things that they have done because they have only applied certain procedure codes and that's it. So that's something that you need to think about. And then whatever diagnosis set that they're working with, like either where it's musculoskeletal or injuries, again, is going to be a very small section. So you want somebody who's had different types of training in different types of settings. Well, a brand new medical coder who has no bad habits and somebody who has passed a certification exam that has tested them on a mix of a lot of different specialties, right? Because these tests, they cover everything. And if you have somebody who's a brand new candidate like that, who better, okay? But the coder themselves also has to bring their A game, because you can't expect for these employers to want to give you a chance if you're not going above and beyond and making yourself the best possible candidate that you can be. Now, yes, if you don't have experience yet, don't feel down on yourself. This is where we all started. A lot of us started this way. But again, trying different things that you would not think of, like these alternative positions, or going with the temp agency and applying with them, seeing what they can offer you. And that is, I think, the best way to get in like that. Like I said, that was how I had success. So work experience, production standards, accuracy. And that's what counts, because that's the first thing that these employers are going to be asking for. So that is my advice for today. I hope you've enjoyed this. Subscribe if you haven't already. And I will be back for lives tomorrow. I'm not going to be at this premiere because I will be in a session. So, but I will be back tomorrow for a live, and I will be discussing, and it will be an open chat tomorrow night. But the theme of tomorrow night is explaining why I recommend going through a longer program, 9 months, 12 months, or 18 months. I seem to have confused some folks yesterday for yesterday's show, so I want to go ahead and clear that up. So if you are interested in that, or if you're kind of on the fence and you don't really get what I was saying yesterday, I will be live tomorrow night, so I hope you'll join me then at 7:30 p.m. Central Standard Time. So I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. Hit that like button, subscribe if you haven't already, and I will see y'all tomorrow. Bye.